We are Team Afoofa from Jacob Wismer ISB and Summa Schools. Welcome to our project presentation. Our project is about following problems due to postural instability in Parkinson's disease. This problem relates to a tiny part in the brain called the substantia nigra. We are being mentored by Dr. O'Shea, a biomedical engineer from Intel Labs. We also met with professionals from OHSU.
Welcome to the third live edition of Afoofa News. Today, we will be interviewing some smart biomedical engineers from the Afoofa lab who are researching balancing and falling problems that people with Parkinson's have. Dr. Afoofa, can you tell us what you are researching about?
Most of us think walking is easy and take it for granted. After all, it is the primary mode of transportation for all human beings. However, walking really is a complex task that involves many parts of the body working in unison. The movement mechanism of walking is one of self-propulsion, so balance is constantly lost and equilibrium regained. The impact is that for over 1.2 million people in the U.S., this primary mode of transportation is robbed by a progressive and irreversible disorder called Parkinson's disease. For people with Parkinson's, walking is one of the unsafe and inefficient tasks of their daily lives because they have a higher risk of falling.
Parkinson's is a neurological condition that affects the control of body movements. 38% of Parkinsonian patients fall. 13% fall more than once a week, leading to severe injuries, and fear of walking has occurred, impacting the independence and the quality of life.
Why do they fall though?
It is because of the lack of communication between the muscles and the brain. The brain must be sending precise movement-related messages to various muscles to maintain balance. Dopamine is a neurotransmitter, which acts like a messenger to carry all these messages.
The dopamine is produced in the tiny area of the brain called the substantia nigra. In Parkinson's patients, this substantia nigra progressively diminishes. This leads to insufficient dopamine production, which leads to a communication breakdown between the brain and the muscles. This is followed by the inability to maintain balance, called postural instability, leading to falls.
Are there any current solutions for this?
There are no permanent cures for Parkinson's disease. However, there is a medication for symptomatic relief. Levodopa-carbidopa is the leading medication. There is also a surgical procedure called deep brain stimulation. Also, there are many walking aids, such as U-step, the laser cane, and PD glasses, which can help prevent falls.
What are your solutions for balancing and falling?
This is the idea of our solution. First, the gait data is collected from the feet. Then, we analyze the gait data to detect falling indicators. If an indicator is detected, then the patient and the caretaker are alerted.
Our solution consists of two shake sensors, a smartphone, and a Bluetooth headset. The shake sensors on the left and right feet send their gait data to the smartphone. The smartphone analyzes the gait data for falling indications. If an indicator is detected, the smartphone sends an audio cue to the headset to correct their gait and alert the caretaker.
We found out that changes in gait prove to be the leading indicator for predicting falls. According to our research, gait is analyzed by using stride, stance, and swing times. These are the basic parameters that we can use to measure and prevent falls.
The base of support gets smaller as the disease progresses. As the people develop the forward posture, the heel strike eventually disappears. Heel strike is another potential indicator that can be measured.
As you can see, the center of gravity of a Parkinson's patient is at the edge of their base of support, compared to that of a normal person.
We decided to use the shake sensor because it's available to us. It is also cost-effective, energy efficient, and easy to use. The shake sensor box has two shake sensors, a processor, and communication devices inside it. We did research on various actuators that alerted the patient and the caretaker. We decided to use an audio cue because the message can range from being guidance to being an alert. We also decided that we would send an alert to the caretaker.
Why is your solution innovative?
Our solution is innovative because of the following reasons. It gives just-in-time guidance to prevent falls. It is affordable, always available, and easy to use. Our solution also has a small size. All-day monitoring makes it so that the patient gets the right dosage.
Wow, this is a creative solution. After all, prevention is better than cure. Well, tune in next year for another live edition of Afoofa News.